Hello, welcome to Spotlight on Souris, brought to you by WCG TV, Access Channel 12. My name is Laura Higgs, and today is April the 16th, 2019, and we have with us today Colin MacLeod, who is our local pharmacist, here to talk to us about sunscreen, sun protection, and expired medications. Welcome.
Thank you, Linda.
Thanks for coming in.
Pardon me.
Thanks for coming in. Listen, why should we wear sunscreen, and what is the importance of sun protection?
Well, you should always wear sunscreen regardless if you're outdoors, even for a short duration, or if you're going on holiday. The biggest thing with sun protection is to avoid exposure to ultraviolet rays. So that's UVA and UVB. Yeah. So that's the most common that you'll hear about. Both of those ultraviolet rays can cause damage to the skin. UVB is more what you think about when you think of actual sunburn.
Surface.
At the surface area. And UVA is, although it's not involved in actual sunburns, it can damage the skin. And
deeper, I think.
Yeah, deeper too as well. So the combination of the two of them can actually cause changes in your pigmentation of your skin. They can cause increased aging of the skin. And in more severe cases, it can cause actually carcinomas and melanomas on the skin. So it's very important that no matter how long you're going to be in the sun, you should be protecting yourself from it.
So then what types of sunscreens are there out there?
Well, there are quite a few sunscreens. Often are combinations of both UVA and UVB protection.
Okay.
They'll come in multiple different kinds, like lotions or ointments, or even like spray-ons sort of stuff. Basically, you just want to make sure that you have a broad spectrum one. And a broad spectrum one is covering both UVA and UVB rays. And there are some sort of, there are certain ones that are cover both of them. Zinc oxide and titanium dioxide actually cover the whole spectrum of both UVA and UVB. And there are some better ones that just protect from the UVA as well. There's a chemical called Parasol 1789, which has a long chemical name, but it will be listed on the back.
Right.
And also Mixoryl XL and SX, and those two chemicals too as well help with the UVA exposure.
Okay.
So you want a combination of two things that cover both of those, because that's basically covering your spectrum.
Okay, and there's some chemicals out there that are not in our sunscreens anymore, which used to be, right?
No, there was it was called PABA. They took those PABA, there was O-PABA and also just regular PABA. Those two things have been taken out of any sunscreens in the UK and also in Canada. They still use them in the United States in certain levels, but they have been shown to affect your endocrine system and also your thyroid. So Canada's basically taken them out, but if you ever go to the United States or you go to another area of the world that isn't under those jurisdictions, they still might offer those sunscreens. So it's very important probably not to use those.
So check your labels for
sure.
Yeah,
or bring some from home.
Non-PABA, yeah.
Absolutely.
I think I was down in Texas this year, and I believe I picked up some sunscreen, and that was the one thing I did. I looked to make sure that they were it was PABA free before I purchased it. So, okay, so what is SPF, and what should we be concerned about purchasing?
Well, SPF is basically based on UVB rays. So when you get something that's SPF 30, it's basically the amount of time you can be exposed after properly putting it on.
So the higher the number, the more time.
Absolutely, yeah. So you're going to see, you actually see some, you'll see SPF even 15s all the way up to SPF 110. Now, through readings that I've done, SPF 50, that's usually the maximum. When you're going up a little higher than that, there's not really that much evidence to make sure that that is actually protecting you for that long duration.
Right.
But the standards are nothing lower than SPF 30. So that's the Canadian standards for that. So you want to make sure that you always have that SPF 30 minimum. You always want to make sure that it has both of those, UVA and UVB, and it'll say right on there. The Canadian guidelines actually have stickers, or the Dermatological Association will stick stickers on, which are approved. You want to make sure that you always have water-resistant formulas. So if you are going to be in the water, which is usually common in the heat, or if you're going to be just out and sweating quite a bit, you want to make sure that that is that the formula you have is resistant.
And
to
sometimes they advertise that as sports
Absolutely, yeah,
sunscreen,
sports.
right?
Mhm.
So that people can be busy and sweating and
Absolutely.
in the water and
Yeah,
stuff.
absolutely. But even though you are doing that, you are supposed to reapply it every 2 hours,
Right.
Regardless. And you always after swimming. So if you
Okay.
even go in the water for 30 minutes, you want to make sure and apply it after.
Reapply,
Mm-hmm.
for sure. So how should you apply? How much should you apply?
Well, you should apply always 30 minutes before you go out into the sun. You should also reapply it 20 minutes after your exposure, regardless. That's the guidelines that they set. Now, everybody always usually asks, well, how much should I apply or what's the appropriate amount? But they have, basically to put it in layman's terms, it should be 1/2 to 1 teaspoon for your neck area and also the face. Should be 1 teaspoon to 1.5 teaspoons for each arm
Each
and your
arm?
shoulders.
Okay.
And then 2 to 2.5 teaspoons for both of your leg, like each leg and the tops of your feet. So that's obviously there's going to be some adjustments, obviously, because people are taller or shorter or whatever.
Right.
But that's basically what you want to do, because a lot of people underuse it and they don't put enough on. They think, okay, well, I've got enough and I've basically put a little bit on everywhere. But it's usually better that you use more than just to be safe.
Yeah.
And a lot of people say, like, you'll get, say, a bottle of 200 mils, where 100 mils only should last you 3 applications. So you should be using almost 30 to 35 milliliters of sunscreen each time for your whole body.
And if you're using it before you go out and you're using it 20 minutes after, 2 hours, then you
Yeah,
use
you're going to be
Yeah.
using a lot. I mean, and it's
If you're on
something-
the beach and
Absolutely,
Right.
right. And that's the time you really need it. And I mean, even when you're going out, like even to mow the lawn, even if you're going out to, do things like gardening around the house, like not many people think that you need to apply, but you should always be applying, especially, for the back of your neck or to your facial area and,
Right.
and anywhere that's exposed.
right, ears, I know.
Ears too, yes, absolutely, yeah.
I worked 4 years for the dermatologist in Brandon, and we've seen an awful lot of skin cancers.
Yeah.
An awful lot of skin cancers, and they were mostly related to long-time sun damage. Tops of the ears, head sometimes, arms.
Absolutely.
A lot of
yeah.
the guys who only have the shirts
Yeah.
that come down to
Yeah,
here.
yeah, the short sleeve
The arms
shirts,
that are
yeah.
exposed, lots and lots of skin
Yeah.
cancers. Not only basal cell carcinoma, but
yeah.
some malignant melanoma as well. So,
yeah.
not very good. So what are some common myths and other useful knowledge pertaining to sunscreen?
Well, I think one of the things is a lot of people like to be out in the sun because they like vitamin D. Like they feel that, getting out in the sun, they want to absorb vitamin D, which is true. You do get that from the sun.
Yep.
But there hasn't been really much evidence that putting on sunscreen will delay or decrease the amount of vitamin D that you get. And I mean, if you are spending a significant time outside, you want to protect your skin, and you're going to get your adequate amounts of vitamin D too.
Even with the sunscreen on.
Absolutely.
Right.
And I think that that's probably your biggest one. There also have been, with children and stuff, like we discussed about PAVA, but you're not supposed to apply sunscreen to children under 6, or 6 months, but as soon as they're over that age, you want to make sure that you apply it all the time. Some people are, a little bit cautious when it comes to chemicals and that, but the benefits outweigh the risks by far.
Sure, so not under 6 months of age. Okay.
Yeah,
Okay.
you betcha. And then there's also the about proper storage as well. So not many people will realize that because the sun is actually deteriorating, or the lotion absorbs the rays, that if you leave your bottle out in the sun, or if you leave it in the back window of your car, it actually can deteriorate and won't work as well. So you want to make sure that you always store your sunscreens in a proper area, in a dark bag if you're going to be on the beach, or in a just not exposed to any sunlight, anywhere in the house. So just like a normal medication that you would want to put into a medicine.
Well, that's good to
cabinet.
know, because there you are thinking that you're applying your sunscreen. I protected myself, what's going on, while you're using
Absolutely.
a sunscreen that was deteriorated.
Yeah, and that will, if you do leave it out, that's also over time too. So you don't want to use a sunscreen that's 6 years old.
Right.
You want to make sure that you're probably updating your bottle every 1 to 2 years for
Wow.
sure. Absolutely.
Wow, okay. All right, so what are other ways I can use proper sun protection?
Well, there are a lot of things to do with the sun. Obviously, you don't want to be out in the sun between 10 a.m. and 4 p.m. The reason is this is the most common, the most severe exposure to the sun when the rays are at their highest. And obviously that's when our UV indexes are always calculated on. You also want to make sure that most of us are going on vacation, if you're going somewhere that's higher altitude, say to the mountains, or if you're going to the tropics, because it's closer to the equator, the more exposure you're going to have to the rays. So they actually don't recommend that you be out in the sun probably in the first 1 to 3 days that you go, which is obviously tough if you want to get on a vacation, right?
Yeah,
so that one, it's hard to do, but you want to make sure to try to not do that. You always want to also, a lot of people always forget about their eyes. You always want to make sure that you have proper eye protection. So with your sunglasses, you want to make sure that they're both UVA and UVB, because that actually contributes to cataracts, and that can actually be detrimental. So on another note, you want to make sure you want to cover up
Protect your eyes.
Yep.
Absolutely.
When you're not if you're not planning on, even if you're walking somewhere very warm, you want to make sure you have very good clothing, dark clothing, tight woven. You don't want to have holes in your clothing, because that can be exposure too as well. You don't want to sleep on the beach. That's very detrimental. You don't want to do that.
Yep.
That can cause a lot of problems too. A lot of people don't know too as well. You want to be very cautious about protecting yourself against the sun when you go to the mountains. Snow reflection, the UV rays can bounce off the snow. Any types of sand, they can bounce off. And when you're on water too as well, even if you are covered up or in the shade, that reflection off the water can contribute to that too.
It still can.
Absolutely.
Wow.
So you want to make sure that that's there. The wind also too, if you're on the beaches or if you're going to the ocean.
It gives you a false protection, doesn't it? Because the wind, you think it's cooler.
Yeah, right, but it's actually,
hot.
that's right. And it actually can cause damage to your skin when you're close to you can get that in the winter too as well, just from damage too.
Sure.
It's very important that you don't realize, if you're under an umbrella, again, not protected, clouds, wet clothing, things like that won't protect you against the sun. It's probably, you have to be very careful, because a lot of people say, well, I'm under the umbrella, I'm not getting it.
Or look, it's cloudy out.
Absolutely, you're still getting UVA and UVB going through the clouds too as well. And a lot of people think that they have a darker skin complexion. They always think that they have more protection. That's irrelevant. No, it just doesn't work that way.
No.
And especially with people, like we haven't mentioned about tanning. Tanning is very detrimental to your skin. Yes, it will prevent you from maybe getting a sunburn, but it's just like damaging your skin to prevent the heart.
Constantly damaging your
skin. Absolutely.
Like over and over again.
I can't stress how bad tanning booths are. Obviously, people like having darker skin, but it's just damaging your skin, and you shouldn't do it at any point.
Yeah. I know some people do use tanning booths for skin conditions such as psoriasis and stuff like that, but they're getting very minimal amounts, just enough to help them with their skin condition, and not laying there to tan. Is what they're doing.
Absolutely.
So the UV is good for some things, but in very limited amounts, right?
Yes, that's correct. Yeah.
Okay.
And older people too as well. As you age, your skin becomes less able to defend the bad effects of UVA and UV. So 50 plus people, you have to cover up, always sunscreen regardless. And that's just because your skin is aging naturally.
Yeah, our whole body is.
That's right, that's correct. Yeah.
We don't have protection against a lot of things. Germs,
absolutely, yeah.
flus, colds.
Yeah, that's right. Yeah, so you want to make sure that if you're older, you do that. And also too as well, if you do happen to get sunburnt or whatever, hydrate your skin. After you go out, and if you've been on the sun, any kind of water-based, hydrating ointments or creams, whatever, always hydrate your skin after you've been exposed to the sun. Okay. That's always a good idea.
Hydrate your skin.
Absolutely.
And hydrate yourself.
That's right. That too, yes.
So that's actually a lot of helpful hints.
Yeah.
To protect yourself from the
sun.
sun.
And you don't think of all of them, but there's a lot of things you can do.
Well, another one we haven't touched on, and I know this is very particular because you being a pharmacist in town, there's a lot of medications that don't mix with the sun. Isn't that right?
Yeah, there is. There's quite a few antibiotics. Diuretics are one that they don't. Any sulfa-based drugs too as well. They basically can cause reactions that are very detrimental. Like they can cause what it's called a phototoxic reaction, which is what a lot of oral medications we always think of as soon as you go outside, any place that's been exposed to your skin automatically can burn within minutes and hours, regardless of your protection.
Yes, right.
And that's what we mostly think of. But there's also the photoallergenic side, where that's more of your creams and your ointments. So if you have a eczema on your elbows or something like psoriasis or something where you apply a steroid cream, you might not get an immediate burn, but it can actually show up 12 to 72 hours after, which will cause a severe itching, severe rash.
So there's a delayed reaction that the sun will cause that cream to give you that itch. And okay.
So that's where you'll see, the increased, I always warn people about the potential it can burn, because steroids too can thin the skin a little bit, and
Right.
so you can have that immediate reaction, which would probably be better. But I mean, any kind of sometimes acne medication can cause that. Anything that is increasing your susceptibility to the UVA and UVB.
Right, right.
So there's those two reactions. Now, the total list, there is quite a few. I mean, it's always best that if you're going on vacation, especially if you've never been there before, if there's something, if you've had a lot of medications or you're on quite a few, you want to make sure and check with your pharmacist. And that's a very easy thing to do. We can go through the list and see what you need to do. And I mean, if you're practicing, good sun protection, you shouldn't need anything, but just in case, it's always good to know, because sometimes people think, a reaction to the sun is an allergy to something else.
Right.
Which it could be, right? Like, oh my goodness, I ate something at the buffet or something, and now I have this reaction. Well, no, actually, it's
a combination reaction.
Absolutely. So it's always good to know that before you go. And it's a very easy thing to look at a patient's profile and say, okay, you this and this, you should be more cautious.
Check with your pharmacist.
That's right.
Once again, check with your pharmacist. Now, talking about medications, can we move on and talk about expired medications? Why do medications have expiry dates?
Well, medications have expiry dates. Basically, companies want to make sure that they're always giving you the ideal amount of medication, because what can happen to medications over time, they can break down. We have like suspensions, like if you have a suspension, or any liquids at all, they can tend to separate. When you're taking oral products, sometimes just the structural breakdown of the drug can actually break down, even though if you haven't used it. I know lots of people, after you leave pills for a long time, they also can get exposure to humidity, so they can either be stuck together or they can break down and crumble.
Like sitting in that cupboard just by the kitchen sink?
Absolutely, yeah, absolutely. So then they break down, and then that's the problem, and then you get into the problems where you might not be getting the right amount of drug.
Right.
A lot of people are almost worried more about it making them sick, but again, it's not helping you. So I wouldn't want you to use medication that's not helping.
And the expiry date is there for that purpose, but it's not that, April 5th of this year.
Yes, yeah.
That expiry date is April, it's not going to just the next day, it's just not going to do anything. It's just a good guide to say that after this date, this drug can deteriorate and not give you the full amount of medication that you were expecting out of it.
Absolutely.
Like our Tylenol, we have them in our cupboards and they sit there for a long time. And
that's, like when it, just like you said, if it's a month usually past, I'm sure it'll have the most. It's when, people have brought me medication for 10 years. And that's no good. Yeah, you got to get rid of that. Yeah.
Yes.
And it's also not, people don't realize too as well, like a lot of times, like with sterile eye preparations, I will tell my patients, you're going to open this, so make sure that you don't save it for another eye infection.
Right.
So you want to use it, like usually it's 30 days. So you don't use it after 30 days, because it can not only not work as well, it can grow bacteria and you can get worse infections.
Reinfect, exactly.
And that goes as any creams that you will apply topically. Obviously, no matter how much you wash, you still will have bacteria on your skin. So when you apply a cream, if you put your hand back in the jar,
container,
or even I always tell people when they apply creams, wash your hands before.
Yeah.
But still, if you leave it for 5 or 6 years, it could grow bacteria, and then you could get a real mass.
And you're adding problems to it.
Absolutely.
Exactly. So those are very important expiry dates. Why should patients not use expired medications?
Well, basically, when I always say
they think, okay, this is only a year and a half old, I'm going to take it anyway.
Yeah, I mean, the most common thing is it's just not going to work. You're basically just not, you're just taking something and it's not going to work. But there always is a chance that, something could happen where it could make you ill. It's just not a really good idea. I mean, obviously you don't, people spend a lot of money on medications and they want to take them when they need them. But I think that, that's the things that could happen with the sickness and just not working it's not worth the
Okay,
risk.
so it's just not worth the
Yeah.
risk. It's better for your health not to take those expired medications.
Absolutely.
It's better for your health to not use that cream and those eye ointments that are a lot older.
Yeah,
Just
I mean,
overall.
it just, you know, you wouldn't use, you wouldn't use a can of tomatoes out of your cupboard that was in there for 6 months after expiry date. So
Or-
it should be the ideal. Like food, it's just
Right.
the same, right?
Or
don't
milk
want-
in your fridge.
Absolutely, right?
Yeah.
Like, I mean, obviously, it's the best before date is there, and if you use it a couple times, that's
But you
fine.
can't open that medication up and sniff it and go, oh,
That's right,
it's-
that's right, yeah,
it's
that doesn't
bad,
smell
or
like rotten
it's going to make
milk,
me
yeah.
sick,
Yeah,
or it's going
absolutely.
to have some germs
So-
in it. There's no evidence to show,
No,
is there?
no, there's not. But
It-
it's
there-
always, that's why the date's so important.
So
with
people are
medications,
just
yeah.
taking a chance by
Yeah.
doing it. So they might as well just eliminate that chance and the
Absolutely.
risk that goes along with it. But okay, that is great information.
Yeah.
I think we covered everything.
Well, I just wanted to say about the expired medications that I know a lot of people in town have done this before, but it's regardless of where you're at, always take your expired medications into the pharmacy.
Don't flush them.
Don't, yeah, because, I mean, obviously, you know, when the medications, they can last for quite a long time in the water supply, and we, you know, we discard them, we send them away to be incinerated, which is the safest way to get rid of them. I mean, obviously, some people, you know, you're not going to drive 50 miles to your pharmacy to take one pill back. But if you clean out somebody's, you know, if you go into your cupboard and clean out your cupboard after 2 or 3 years, just bag it up. Like I know here at Whitfields, we get rid of all the medication. We recycle whatever we can for old boxes and old containers. So we try to get, you know, try to be as earth friendly as we can.
okay.
So yeah, so I mean, we do that.
So you're not
And-
just taking the medication, you're also recycling.
yeah, we're
everything else that
recycling
you're-
any
good,
plastics, any
Good to
paper
know.
that we can reuse. So just to make sure to always bring it to the pharmacy if you can.
Good, very good to know. And handy for families to know too, because a lot of us are helping our elderly parents and aunts and uncles and
Mm-hmm.
stuff like that, and we need to know what to do with that.
And also, if you have young children too, that's always a good idea to make sure you don't have meds lying around.
Right,
Yeah,
right.
absolutely.
Very
So,
important.
Mhm.
Well, we thank you for your time.
No, thank
Thank you,
you.
Colin, for coming in. It's wonderful to interview you, and thank you for your information on sun protection, sunscreen, and expired medications.
Thank you.
Great. Spotlight in Souris is brought to you by volunteers of WCG TV. I'd like to thank Gil, who's our cameraman today. My name is Laura Higgs. Thank you very much for joining us, and have a great day.